As far as the role of radiation therapy, this is not a common question up front from the patient side. This is really something that's driven by the surgeon. I will say that there are some tumors or specific cancers that are particularly radiosensitive, and some that are not. For instance, we know melanoma is not a particularly radiosensitive cancer, and therefore it is really not the mainstay of treatment for early or intermediate stage disease. For all types of skin cancers, the most important concept to really nail down is local control. So attacking it early, and when it's attacked early, removing it completely. There are roles for radiation therapy with certain high-risk features in specific tumors. And without getting into too much extraneous detail, the second most common skin cancer, squamous cell carcinoma, has been shown to have a role for what we call adjuvant radiation therapy whenever there are high-risk features involved. And how you define those high-risk features are really innately related to the tumor itself. So when a Mohs surgeon or a skin cancer surgeon gets the pathology reports from the biopsy back, if there are features that really indicate that this is a bad actor, sometimes in select circumstances, a discussion about radiation therapy is warranted with the patient. Another skin cancer that we see that is particularly radiosensitive is Merkle cell carcinoma. We've found in a study that was done even within the last 2 years that wide local excision and plus radiation therapy, particularly for the head and neck with Merkle cell carcinoma, is considered standard of care. When we treat with Mohs surgery outcomes alone are comparable or at least as effective to the combination of wide local excision and radiation therapy. And that's been a relatively new, hot off the press type item. We're still, I think one should realizing that we're still evolving these practice guidelines. And so it's much more nuanced than what we can say in broad strokes on a forum like this. So I think it's a fantastic question, but I hope that no one needs it. But I think that your surgeon will be well equipped to initiate that conversation with you.